Welcome, everyone. Thank you for coming back to the Ohio podcast, where culture, cannabis, and community converge. Tonight, we're joined by one of our most popular and impactful guests, Tim Johnson, retired law enforcement officer, Air Force veteran, government affairs advisor, and founder of Cannabis Safety First. Tim has been at the front lines of Ohio's cannabis and hemp legislation from the very beginning. And with everything happening right now in the State House, there's no better time for this conversation. This episode is about clarity and action. There's a lot of noise and confusion right now. So tonight, we are giving Tim the floor to break it down and help us all understand what's really going on. Thank you so much, Tim, for coming on our show once again. You have the
Let's see it,
floor.
lady.
Oh, Will, you're back.
I got it.
Are you in here, Will?
Yeah, I'm here. I'm here.
Okay, fantastic. So yes, Tim. So start right there. What's happening right now in Ohio cannabis legislation, and what do the people need to know?
It's thank you for the introduction and for you guys having me, and I really appreciate what the Ohio channel family does. For the cannabis centers here in Ohio and so forth. You guys do a lot of great positive educational awareness and good outreach. I'll start off with a disclaimer that I am not an attorney and I am not a lawyer, as frequently I get asked and get challenged. But I can say that I have had 10 years experience at the State House in creating our medical program, the HEP program, and as a legislative policy advisor on issue 2, trying to come up with the correct language. The language that's currently out there, trust me, I had nothing to do with the creation of Senate Bill 56. I had a lot of input on it and so forth. But I think just to start off, we'll say, Senate Bill 56 has cleared the House. It goes back to the Senate on Wednesday, and they have an opportunity there to make some changes, amendments, and so forth. And then after that, it goes to another process and then on to the governor. And then there's so many days before that. But yeah, hopefully today we can clarify some of the myths and some of the rumors and stuff that are going on out there, because we still have a long way to go before the bill is actually codified into statute in the revised code and administrative code and so forth. So we'll actually know what the law is, what the rule is, and as well as what the penalties for violating some of them are. So we still got a ways to go, but at this point, I'm not afraid to say I'm not happy with what the legislators have done to issue 2, and it is what it is. But so we have to continue to stay alert and active to what we're doing, and hope that as a community, as a cannabis community, and as the license holders industry, that we can unite in a positive manner and address the State House, the lawmakers, as we need to, so that we can have a full, robust, inclusive, vertically integrated, sustainable business model here in Ohio.
So can you break down for us like the main issues with the bill that's in question right now?
Yeah, some of the concerns with this is the fact of legalization. As I've always said, legalization is not legalization until you're free from prosecution. And
Yes.
unfortunately, issue 2 has proven that to us with the Senate Bill 56 intervention into it. So there's still a ways to go as far as what are going to be the actual issues and so forth. Criminalizing cannabis in Ohio when we're trying to legalize it. So I've never believed in the word legalization. It's always regulation for me. If it was legalized, we wouldn't be having the problems we're having today. So it's the regulation, and some of the regulations they've imposed, they went a little overboard with the fact of regulate it like marijuana or regulate it like alcohol. I never cared for that phrase, and I think it's caused us. Now I know it's caused us more harm than it's done good, especially the hemp industry. That's just what they just did to them. They basically took the cannabis program, took out the word cannabis and put the word hemp in. So now hemp is treated like cannabis when we know at federal level, it was in 2018, the Agriculture Improvement Act, known as the Farm Bill or Hemp Bill, kind of descheduled and decriminalized hemp. But Ohio has now taken it and criminalized hemp. So some of the main factors that are out there right now, and I've skimmed through the bill and I've skimmed through a lot of the summaries and the fiscal impacts and so forth, and reviewed some of that. So I still have a ways to go. I like to go over it a few times because each time you go over it, you find something different. But some of the things that surprised me is the fact that you purchase cannabis in another state and you come into Ohio, they can hit you with, it sounds like they're going to hit you with a felony right off the bat if it's from another state. That's totally asinine, totally ridiculous.
That's yeah, that's crazy.
Something needs to be done on that. There's they went into the medical program and they redacted the child custody right that we've fought for in there. And back in 2016, this wasn't no easy task getting that medical program going. So when they go in and we had, your custodial case and so forth, you were protected if you were a medical patient. If you had a professional license in the medical program, you were protected. Now they've withdrawn that and taken it out. But I find ironic with that is all the employees in the state, or all the employees in the cannabis and hemp program are all state licensed. You're not licensed by your employer. You're licensed by the state. So, and then we got to do background checks now on people selling hemp. And we've got, charges at the register. If you sell to somebody under 21, it's an M1. Second time you do it, it's a felony 5. Well, I can sell tobacco and alcohol to underage kids all day long. And the first, your offense is a misdemeanor 4 for tobacco and a misdemeanor 1 for alcohol. It never escalates to a felony. The penalties increase, and they may take your license for 30 or 60 days for the business. But why is it that hemp has to be a felony charge and these other issues are still misdemeanors? The other part we can talk of is possession, as far as sharing and gifting and so forth like that. Evidently, you're not allowed to share and gift again. They went back to that in 56. They've taken away workers' compensation, unemployment for those that work in the industry, so that are no longer protected for those things. Transportation of your products. I just don't get the fact that it has, okay, if it's got to be in the original package, that's fine. But you're telling me that I'm allowed to have paraphernalia, but it has to be brand new. So if I gotta go visit a friend, what they're telling me is that I have to have a brand new package from a dispensary that's not been opened and a brand new piece of paraphernalia equipment, a water bong or whatever it may be. They got to be brand new in the original package, locked in the trunk or in the back seat where I can't reach them. I think that's a bit overboard. They've banned consumption spots in Ohio, such as hotels. We're at the point where they had the opportunity, if a hotel was privately owned and they said, we out here on the patio where you can smoke your cigar or tobacco, you can go smoke your joint. Well, that's been redacted. They're not allowed to do that now. So they're kind of like tearing the hospitality community and the cannabis community apart, making Ohio a hostile environment for cannabis individuals, that travel. It's like, well, when you go to Ohio, the hospitality, and this even goes to a VRBO. So, you can't, you go through Ohio, you can't, if you got a VRBO out in the middle of the woods and they catch you out on the patio, you could be in trouble. So those are a few of the issues. Probable cause on smell, which has always been a big thing for me. There's some confusion on that. That says if an officer pulls over a car and they smell the odor of cannabis, now if they see a package in the car or a joint in the ashtray or whatever, now they can pull the passengers out, pat them down and so forth. They can be charged. I don't think the language is quite clear on what that charge is going to be yet. Misdemeanor, I think that they did get rid of, I believe, the 3-day mandatory jail. But that's the trick around that is if an officer pulls you over and smells cannabis, the driver, and there's 3 people in the car, you can pull the driver out automatically because you're going to go for impaired driving now. So you don't need that exigent circumstance of the totality and circumstances in that traffic stop now. If I'm just going to say, well, I'm going to test the driver, see if they're impaired, the other 3 people in the car, I need to know your ID and who you are. And there's a possibility of even patting them down and finding a nickel bag or a dime bag or something on them, and then they get charged. So those are some of the big things. Let's see. The stuff, the expungement clause. I got to touch on that. This is a killer. Um, we're talking about since 1975, Ohio's been a decriminalized state, up to 99 grams. No
Hmm.
fine or a fine of up to 150 bucks, no jail time. Minor misdemeanor. Doesn't mean anything. Um, all of a sudden now, and you can't tell me that the individuals that introduced issue two weren't aware of this because I made them aware of it because I know they introduced that same thing like 4 years in a row before they finally got it right. And this is like three law firms working together. It took them that long to do it. Finally got it on the ballot, but I told them many times, wait a minute, you guys are going backwards as far as our weight limits for decriminalization. So our new weight limit at this point now looks like it's going to be 70.87 grams. So we've essentially went back, 28 grams, as far as your possession when you're out and about in the community and so forth, if you go over that. So the expungement thing says that you can have your expungement done for as long as if it goes up to the 2.5 ounces. If you had something done 20, 30 years ago, you got a conviction of a minor possession, and it's as long as it's up to the 70 grams, you can get it expunged. The funny
Hmm.
part is, again, that's a minor misdemeanor. Why aren't we expunging felonies, etc., and so forth? And helping
Right.
these people get back in, acclimate them back into society and so forth. So I'm a little bit skeptical of that. Not only that, in 2023 House Bill 1, we passed a new expungement program in Ohio where you can actually do multiple misdemeanors at a time, and you can now do two felonies at a time, where it used to be one at a time. And that was not in no way related to the cannabis program. So the new cannabis statute is now the 70 grams and to go, and it's $50 to go get it expunged, whatever. But it's I don't know. I would feel safer going through the state regulated program that they currently have. But those are some of the major things I think that people need to understand out there. There's a lot more. There's actually rules in there for license holders, their expansion and what they can and can't do. There's in the hemp thing, there's all the packaging and the 21 and over and so forth. So that's kind of a real quick rounded thing.
Thank you so much for that. Why do you feel like they have such a huge like hostility towards cannabis and not alcohol, considering like alcohol causes so many more deaths in comparison? Like it's doesn't have any medicinal value, you know? Why are we even why are we going back and forth about it when we've already established that cannabis has medical value?
Okay, there we go. I don't know if you guys have seen the stuff out there going around, but Representative Brian Stewart, when he was challenged in the House Judiciary Committee as to kids, one of the Democrat legislators that inquired of buying, I think it was they were talking maybe about hemp at that time, and so forth, or cannabis or whatever. Why was and I think it was why is that it was actually cannabis? Why would that be a felony 5 on the second thing, but the other is a misdemeanor 1?
Yeah.
And his comment, not to quote it word for word, but basically was, we would rather have our children purchasing and drinking alcohol than we would purchasing and using cannabis products. So that goes to show you the definite stigma, the ignorance of knowledge to what the difference is between the two. Alcohol being the number one killer in the world, the number one problem for criminal behaviors and actions and so forth, from domestic violence to violence on the streets, violence in the bars, having people just do anything. You get on alcohol, who knows what you're going to do. The violence, the OVIs, the car pursuits, all that type of stuff that alcohol contributes to society. We haven't found that in cannabis. Having worked the streets for 20 years very actively in very active communities, it was daily contact with this stuff. Cannabis wasn't the problem. Cannabis a lot of times was our savior. And I'm able to say that now, and I don't have a problem with sharing the truth on that now. But alcohol, there was always going to be a problem if alcohol was involved. And it's unfortunate that the lawmakers, not just in Ohio, but across the country, are still blinded to the fact of what the real problem is, the societal problem, the medical problems, the mental health problems, and et cetera, which all of this affects and rolls down to healthcare coverage, the cost of healthcare, hospitals, fees, et cetera, and so forth. So when it comes to saying, the legislators always say, it's about the safety of the child. It's about the safety concerns. We're concerned about the children. I got to call bull or BS on that, and I got to throw the red flag and say, nah, that's not the truth. Let's talk about the alcohol they get. Let's talk about the firearms they have access to. Let's talk about this real simple. For the last 4 years, I've introduced a bill on melatonin, a gummy we have actual incidents of children dying from that. I have talked with several parents, medical people primarily, whose children have teenage kids have spoken to them and says, hey, look, I can go into any vitamin store, grocery store, and I can buy a jar of 200 10 milligram gummies of melatonin. I can sell them for $10 a piece on the street, and it's $2,000 they're bringing in. And what it's really become is the adolescent's legal narcotic on the street, and we're doing nothing about it. But we are seeing children dying. We do believe, I believe, and some of the people that emergency room people that I'm aware of, and doctors and so forth I've consulted with, a lot of the cases that we're seeing that we're blaming that kids are going into the hospital ERs over saying, well, it's either intoxicating hemp or it's cannabis gummies from the dispensary or whatever. I believe if they start doing toxicity reports and actually documenting this, that a lot of it can be melatonin. As I've introduced that bill for 4 years in a row at our Ohio State House to every doctor that's down there, that's a lawmaker, they've got a copy of it, and nobody seems to care. So when they talk about safety, child protection, and stuff like that, like I said, I got to throw the BS flag. And Brianna, you couldn't be more right. Alcohol is the destruction of society, in my opinion.
Gotcha. Well, thank you for sharing that, because I mean, I don't even know what to say, because it's appalling, really. The disparity there. But moving along, how soon do you think these changes could go into effect if this bill goes through? Or like, what's the next steps kind of that we're going to see?
Well, you'll see a vote on the Senate floor this coming Wednesday at the State House. I believe it's at 1:30 in the afternoon. Everybody's invited to please show up by the masses. You don't get to speak or anything, but fill in the place with bodies is what we want. We need to let them know that, hey, we're still concerned about this. We still have issues with it. So, it's kind of work with us on this and so forth. I do believe it's going to pass the House floor. I'm just not aware of additional revisions or amendments they may add to it. That's very possible. So after that, the next step is, whatever they accept those revisions and so forth. I believe it goes through one more clearance after that, and then it would go to the governor's office. And then, of course, he's got 10 days to sign or not sign. At the end of 10 days, if he doesn't sign, then it becomes law. And then it would go into effect. It's either, I think it's 60 or 90 days after that is when it would go into effect, actually be codified. And that's when, law enforcement and the prosecutors and the judges and all stuff would start getting busy on hopefully learning the new revised code laws and rules and so on, which they've done poorly on to this date. It's literally 10 years and they've done nothing to train them.
So
that's how
let me
simple
ask
it
you.
is.
Let me ask you this: do you think the Senate will pass it as is, or will it be pushed back?
I think they're going to throw a couple amendments in there. The House pretty much took the original version of Senate Bill 56 from the Senate. And at first, they were kind of like thinking of the actual consumers and the program and the patients and so forth, and they redacted a lot of stuff, especially the criminal justice parts of it. They had redacted it, but now it looks like they've put. There you go. You got me. Okay. Yeah, they put most
Sorry
of it
about that.
back
Yeah.
in.
Sorry about that. Yeah.
No, that's all right. Yeah, they've taken, the House have added it back in now with this sub bill. And I know it says sub bill, Senate Bill 56, but that's a conglomeration of the House, primarily the GOP, controlling this. This whole bill the whole way through, and I'm sure that the GOP leadership in the House and the GOP leadership in the Senate both concurred on what they were going to do as far as in the House changes, and they just really came back and they've said it themselves is that the people came down and testified to regulate hemp like alcohol and to regulate cannabis like alcohol, so they went into the revised code into the 4511 section, I believe, if I remember correctly, on alcohol issues and so forth, and it basically took the word alcohol out and inserted the word hemp or cannabis in there, and that's pretty much exactly what they did. Kind of like an open container, impaired driving, sharing with someone underage, etc., etc. So or selling to someone underage. So it's kind of what they did. That's why it irritated me to associate the issue 2 with just like alcohol. There's no comparison. There's no comparison at all, not even in the law. Should we even be, entertaining that type of phrase? So I do fear that, the Senate will probably make a couple changes or request a couple amendments. So, and it'll be passed because, as we know, the GOP in the Senate, as in the House, they've control the Senate and the House, and they have for 20 some years now. So
I got you. I got you. So where do we go from here? Do you think what do you think is motivating these politics and like the changes and the legislative rollbacks and what's motivating all this?
Um, I'd say a lot of the motivation comes from the fact that they didn't think that issue 2 was passed. And when 2.2 million people came out and voted yes for it, more than the governor got, I think it's kind of like a jab in their side, and they didn't expect that to happen. Ohio wanted them to remain that, Midwest virginity community or whatever you want to call it, which is like, come on. We got a $4 to $5 billion cannabis industry here, but you guys won't accept that. But yeah, I think a lot of it's still just the stigma of, and I'm not trying to be, sarcastic about it, but it's just the ignorance to their knowledge of what cannabis really is. Why did it become illegal? You know, they're not aware of the medicinal values and so forth. 2022, 35,000 studies, peer reviews, research papers, and so forth were added to the National Institute of Health. 35,000 studies on one plant. But the federal government says, well, we can't accept those because they weren't government sanctioned. Well, so that kind of sends a strong signal right there of, the stigma, how strong it is and so forth. And then I don't doubt, there's a lot of other underlying layers of, religious organizations. They've been down there and shared their input on it. There's some of the tobacco industry, some of the alcohol, even though the alcohol wants to get into it and tobacco wants to get into it. We know they both have their own brands already, such as the cannabinoid drinks and stuff that they're permitting in the hemp program and so forth. Alcohol's all over that. But I think what they didn't get this time was they didn't get their cannabinoid drinks in the cannabis part. So I think there'll be an issue with that. You're giving it to the hemp program, but not to the cannabis program. And as tobacco's always wanted in on it. They've had patents on stuff for decades and so on. So at this time, my biggest thing right now, I believe it's there's the stigma of what these controlling legislators, what they believe in and what they think is really happening. So and as we know, they've exaggerated it and so forth. We've heard Matt Huffman talk about how teenage suicide is up, and it's up because of cannabis consumption. There's no proof to that. We've heard about this ER visit, that ER. We've had Dr. Hannah Hayes, I believe her name is, that came in 2 years ago. Yeah, I'll drop her name. She knows who I am. She came in and In her testimony, she lied about children in Ohio dying from cannabis gummies from the dispensaries. Um, and and when she was challenged by the one legislator, who I love dearly, I'll keep her name out. But anyways, when she challenged her, the doctor says, well, I've got proof of it. So the legislator says, well, you don't have to go look for the proof. I've already looked it up. No child in Ohio has ever died from a cannabis gummy. So when we get doctors of stature like that come in and lie, the public absorbs that and they take that up and they believe it. When we've got a governor that comes out and puts this stuff out there and says this is what's happening and so forth, that lies about this stuff, people believe that stuff. They're gullible, as humans, we're gullible to, especially to leaders, community leaders, and so on. So that type of stuff has just really got to stop. They got to get over it and let the program roll as the program should roll. You might, Will.
Anyway, sorry about that. Do you? So for lawmakers, I'm gonna mute you real quick because you're echoing. Hold on. All right. So for the lawmakers, ignoring the will of 2.2 million Ohioans who voted yes on issue 2, how do you feel about that? Because I know there was a vote put forward up, and y'all voted yes to make sure that it's there, but now it's just like the legislative is basically walking back and not caring about what the constituents say at all. So how do you feel about that?
Um, it's quite disgusting, but expected under this current administration and leadership and so forth. I mean, they did the same thing for women's rights. They've done it now to the passage of cannabis, and I don't know how many other things that we could go back in history and say, hey, this is where they've ignored the will of the voters. This particular, well, the GOP has. It is what it is. Um, you know, um, so I think it's for me, as I said, I expected it, but again, it's disgusting that they don't respect the will of the voters. The problem we have with the voters then after this, and you hear people all the time, vote them out, vote them out. Well, first of all, you got to get registered to vote before you can vote. So we need more people to do that. And then we need to get the mentality of I have to party line vote. If I'm red, I vote red. If I'm blue, I vote blue, whether I like it or don't like it. We have to get away from that two-party system in the way that we actually vote, the way they dictate your vote here in Ohio, and I'm sure other states as well. In the what is it, the primary or the general election or whatever, you can
Hmm.
vote both parties, but in the final one, then you got to vote your party. Well, what if I don't want to vote my party? Why can't I vote for both parties at the same time in any of the primary or general? Why can't I do that? So that to me is dictating our vote, but we just truly need people to come out, and regardless if it's your party or not, if there's a better candidate on the ballot, then we need to vote for what we want, not who we think we are. Um,
Yeah,
you know,
I
I'm an
agree.
independent myself, and I don't get to vote independent out there. I got to vote Democrat or Republican, and I see goods in both sides, and I also see a lot of bad players on both sides. So, that's kind of what irritates me. But it does come down to voting in the right people, and then once those people come, like every 2 years at the state house, I see a turnover of new politicians. So, I try to get to as many of them as I can, and I do an educational awareness meeting with them real quick on cannabis, drug policy reform, criminal justice reform, law enforcement reform, things that I address, civil justice and so forth. But so that's what we got to get. If you quit saying that you're going to break your party and you're going to go vote over here. You can still stay a whatever party you want. Just vote for the candidate that is in favor of what what you want. Look at the language,
Yeah.
look at the ethics of that language and so forth, the quality of it. And the same thing in the politician. Look for them and then, make your vote off of that.
Gotcha. So last question I got for you Yeah, you mentioned the difference between hemp and marijuana regulation. Like I know for Ohio and Kentucky, those are two big industries in the state. Because I'm in Kentucky, so so me looking from the outside in. I'm seeing all this going down up here, knowing that we're going to have to gear up to get ready to do the kind of the same thing down here. So, can you unpack what this new bill could mean for small hemp businesses, just also in Ohio, and for Kentucky too?
His mic.
Yep, I'm cutting them on now.
Okay.
There you go.
Oh,
There you
got me. Okay. I'll say this. I'll start it this way. For Kentucky, congratulations on your medical. I did speak with several legislators down there when they were talking, going through the process of going to pass that or whatever. I hope it had an influence. I think it'll be a few more years before they go to adult choice. But we'll see how that. Tennessee, right below them, is about the same thing. Um, as far as hemp in Ohio, I think we're going to devastate the hemp industry with these rules. We're looking right now. Someone gave a figure of 6,000 gas stations, mini marts, head shops out here that have the bad players, the adulterated, the intoxicating hemp on THCA, all that type of stuff. I don't have a problem, and I've always asked that let's get rid of this stuff and regulate it for the safety of our children. And so this has been since 2018, when I partnered with Julie Duran, you guys know, and we introduced the hemp bill, and that was passed in 2019. So we've asked for this stuff since 2019, even though some of the stuff wasn't as plentiful, but we asked for some type of retail regulation to protect the hemp retailers. Well, they've blown it off for 6 years. Um, and again, I've introduced a bill every year since then asking for that. And I think the way that they're doing this with this 400 cap of what they're going to do, grandfather in up to 400 of the current, what we're going to call a real hemp retail store. That's what they do, sell hemp products. And they have other little things to bring in revenue as well, because no hemp store is surviving solely on just selling hemp products. They've got other things that they sell and so forth. To And that number is 1,200 to 1,500 that we're aware of, in Ohio. So they're already wanting to cut that down a third, or two-thirds actually, down to cap it at 400. So if the first 400 applicants that will apply meet the qualifications and they get their retail license for hemp, everybody else is cut out. So no more new licenses. It's capped, just like the cannabis program is. We're capped. Michigan's uncapped. Ohio's capped. That's why you see such big differences in the numbers. So I think it's going to devastate a lot of businesses in Ohio. It's going to have a huge business impact, as far as employment for people, facilities being rented, facilities being built, the taxes that come in, and not just from products that are sold, but the employees and so forth, and family devastations and so on. I believe it was 2022 or three. They It was presented at the state house how, I forget, so many billion, like $3 billion in hemp was sold during that year. It threw in about 545 million into taxes into the state's coffer. That same year, the cannabis program didn't even reach half of that. So the business impact, family impact, that we're going to see over this overall revenue impact. I don't like the tax thing and stuff, but taxes is a reality, for state revenue coming in and so forth. So they're not only harming the people of Ohio, the constituents of Ohio and so forth, but we're harming the state as well. And we just need to open our minds. We need to get out there. We need to think of educational awareness on all fronts, public service announcements, et cetera, and move along with this. It's been too long.
Okay, thank you. So you kind of started to talk about it. We were going to move into people and impact. So maybe you can add a little bit more to this for patients, parents, and new consumers. How do these changes impact their everyday life, you would say?
It affects them drastically. I think it could be, difficult, whether it's cannabis or hemp, whatever you're using for your, your physical ailment, your mental ailments, whatever they may be. You should have a right to that choice of your own health care. And it's going to, I really believe it's going to limit the opportunity, the products and so forth that patients and consumers have been purchasing, what they've been using. So we'll see an impact on, how far do I got to drive to get my product now? Is my product going to be available consistently? Is a good quality product? And yes, they've got testing and all this labeling on pack and so forth, but there's going to be a big impact there, aside from the employment side, but for patients primarily, which is how we started out with the medical. You can't scare us with criminalizing the program to come to your dispensary. What you do you might have got away with it elsewhere, but in Ohio, you irritate people when you do that. You're trying to dictate to us what you want us to do, and we don't like that here in Ohio. So I think you're going to see a lot of them maybe going back, to the street, purchasing online, purchasing from unknown individuals and so forth, and they may be getting products that they probably shouldn't, have a hold of. When if we did this properly and made it available, I mean, come on, let's look at how many liquor licenses get issued every year. There's more liquor licenses issued every year than we have cannabis license holders in the state. So we don't have a problem getting a hold of that. But, when it comes to, hey, we've decided not to use big pharma's pharmaceutical drugs because it does this, it does that, and so forth. We want this holistic approach. It's been effective. It's been proven in the pharmacopoeia in 1850 to 1942. One of the top 3 drugs, used in America and stuff. The gateway drug has been debunked by a federal study in 1944, LaGuardia report. So all of this stuff, we start putting this together, and you look at the lawmakers and say, well, you really don't really care about our health. You just really don't. And we're seeing a lot of that right now with what's going on, nationally and so forth. But as far as sticking to Ohio and so forth, it can be become a problem, I think, for being able to help and treat people. Regardless of what it is, if it's a pain issue, if it's arthritis, if it's PTSD, whatever it might be. I just hate to see patients are going to have to suffer over the ideologies of lawmakers here in Ohio.
Thank you. Yeah, so that does sound like it's going to be not only confusing but frustrating for a lot of people. So let me just kind of switch gears here. You train dispensary and cultivation staff. What's the mood in the industry right now?
The industry is a little skeptical. A lot of the industry is younger individuals that are working in there. They're looking to, for a career that they may be able to make a lifetime career out of this. I don't see that practical or feasible at this time. Due to wages, lack of benefits, retirement plans, and so forth. And now you're going to be cut out of, if you get hurt on the job and you get laid off or whatever, you're not covered or you're not protected. I hear from a lot of those that work within the industry that, and some of them have done it. They've went to the unions and have looked for support, and rightfully so. In my opinion, every facility in Ohio should be unionized so that they do have a collective voice rather than each individual person trying to go to the company owner and saying, hey, can I get this or can I get that? And they say, get out of the office, you're fired, you're terminated or whatever, But if you have an organized union or an organized unit there that can, speak for you on your behalf, we know that holds more power. That's, first responders, they all have unions. The nurses have unions. A lot of truck drivers have unions. There's a reason for that we have that collective bargaining voice as a mass rather than individually, because then we're more protected. And I see, I hear, some of the elderly people that are, they go work in a dispensary or whatever, they do it for a secondary job, for entertainment anymore and so forth. They've been, they're done retired or whatever, and they're having fun, or this is an additional job and they're good to go. But for some of these younger, employees in there, I hope that it doesn't come back in the future when they said, okay, well, I've been in this industry for 10 years. I got a good job offer in, I don't know, in the insurance industry. But they want to know what my work history was. And when I show them that work history on my resume, are they going to say, well, we don't want you, you're involved in cannabis? So are those are those resumes going to become harmful for something that you worked in for a long time and maybe were very successful? You enjoyed it, you had a good time, no criminal activity involved, legal by the state, but you still have that company or that entity that you're going to go work for that says, well, we've chosen not to take you, and we know why, because they're not going to come out and say we're not going to hire you because you worked in the cannabis industry. But that's going to be a big impact, I believe, on resumes for the future.
That's a good point. And that's a really intense thing to kind of consider for the future for a lot of people. With the stigma still being around, and everyone kind of hoping that we kind of outlive that, or the people that, are still heavily stigmatized, are like on their way out. I always hear people say, right? But
hmm My big thing is like the stigma itself. So like Tim was saying, like if I'm going to try to find a job and I've been in this industry, I mean, you got some folks that's been in the industry for what, like a couple of years now, and they've made everything like all their whole career is based in this industry. If they take it and try to transfer it somewhere, I almost feel like that would hold that against them if they tried to apply somewhere else because of such of the legislation and the politics going on right now. That always has a lot of influence in everything that we do. So that would be my worry, is that people who are in the industry couldn't transfer and find other jobs. While you have this whole industry, which is very, I mean, I don't understand. For me, like I said, I'm more of a newer guy coming in. This industry is solid. The people that I've met in this industry, they know what they're doing. They know what they're talking about. This industry is also moving on itself to overregulate itself, as Josh said in the last episodes that we had. We're there are people who are well minded and are taking care of what they need to take care of when it comes to the responsibility of being in this industry. So that's why I'm so confused about the push for trying to basically just devastate it. It doesn't make any sense.
yeah, good times, Mike.
I guess you have to look, there's a purpose for a resume, and that is for the employer to see who you were in the past. And so there's a lot of employers, and let's hope that the stigma does change and the cultures change and so forth. But it's kind of like a light background check. An employer is going to look at that, and you might be trying to get into hospitality, and crap, you could have been a CEO for 10 years in the cannabis industry, multi-million-dollar company or whatever. And they look at it and go, well, that's your experience. We're still going to see that. We're still going to face it. And I really feel for the younger employees that are putting time into this. I wish that, and I hope that that opportunity that they're able to stay. And if this has to be a 30, 40-year career, like any other profession, then let that be. But let's get them paid fairly. Let's get them protected. Let's make sure Social Security is going to be there for them. Retirement plans are going to be there for them. This just ain't about bringing in young people into this industry to go out and sell our products for these multi-million-dollar companies and so forth, and then let us make more money. And if something happens to you in the future because what your resume says that you work for me as a big owner, if that harms you, oh well, it is what it is. But this is, I mean, it's exciting. You have to think about, when was the last time that not just a state or a national or an international new industry came into existence? We're trying to move away from the illicit market. I mean, it's going to be there forever, as it is in every other thing. But we can still downsize on that, and we can build a very good, a strong new industry off of the acceptance of those that work in this. The knowledge in this industry is unbelievable, of what people know, not just in cannabis, just in other aspects where they come from. IT people, healthcare people, first responders are coming into it. Politicians are coming into it and so forth. So, we have to look at that this just ain't about, people wanting to get a hold, a bag of weed and have a joint for the weekend or whatever. This is a real live industry now, and we have to be respected as that, and people have to look at us as that. But in the same sense, we ourselves have to step forward and present that. And for a lot of people, it's difficult. For me, I'm retired. I can go down to the state house a couple, 2, 3 days a week, do what I want to do. I answer to myself. I wear a shirt or a hoodie that's got Cannabis Safety First on it out to the grocery store and think nothing about it. But I understand when a younger person, and 20s, 30s, 40s, even people have come up and say, well, we can't wear that to the store, Tim, because somebody will see us wearing that, or somebody sees us go into the dispensary, then all of a sudden the stigma kicks in. And the people at church don't like it. Your neighbors don't like it. You get fired from your job, whatever it might be. So all of that's got to change. And we have to stand strong, as a community, as a family, as an industry. We have to unite and fight for each other and stand up for each other to make this a success.
Thank you, Tim. And I agree. I feel like we're on the right track as far as organizing, coming together, trying to educate, spread the word. So I definitely am encouraged in that. Got one more question for you. So you've always said safety first. What does safety really mean in this moment for our community?
Safety first for me, it's always been about not just like protections of a facility, security systems, or safety measures and so forth, security measures inside the facility and so forth. But it's also been a reflection of, yes, safety for, we need products, we need safe products. We need to make sure that what we're getting is regulated somehow to where it is properly tested, that we're getting good products, that we're not getting some K2 from the 2000s or whatever off, getting chemicals from who knows where in the world that, it could be something sprayed on catnip and you're going to go and you have no idea what it is. So it's always been about safety for me. That's why I kind of laugh at the legislators when they say, what's about safety of the children? I says, well, I told you that back in 2015 when I introduced the paper to get this stuff going, but you didn't want to listen. So safety first is a realm of, not just for the facility, but for the consumer as well, for the product, and to set a good example for the industry as a whole that we are concerned, as far as, how our programs operated, how the industry works, the consumption of our products and so forth.
Thank you, Tim. And so I meant to say this at the beginning of the show that I wanted the viewers to get some questions in the chat for us. I do apologize about that, but that's that's supposed to be our next segment. What's up, Will?
Hold on one sec. All right. So I got some Instagram comments. I do. People on Instagram have been responding. I got Josh from App Goes Canada. He's saying Republican or Democrat, something not worth your time even to debate. Scum and hero on both sides is what he's saying. So he's absolutely appalled about what's going on. Miss Wendy said alcohol kills, and then she was mentioning like guns. Lobbyists are working for the license holders, so she's mentioning that. Um, that is what I got so far from Instagram. But yeah, it sounds like people are on the same page. People are understanding that, like, this is bull. Like this ain't really a
Yeah.
thing that we're trying to do. You know what I'm saying? Just to like help people out. No, this is like truly some bull.
Yeah, it's definitely not about, it doesn't really seem like it's about health, safety. I mean, it really just sounds like it's about, other people's agenda, money, ignorance, stigma, you know.
hmm So let me do this. So Tim, you got the pulse on the movement. Like we see you at everything. You're at every event. You're like the granddad basically of everything. Every time we see you, we get excited to see you. You do. So, what's the most effective thing Ohioans can do right now to push back or get involved?
There we go. Okay. Um, as I say all the time when I speak to people, and I think just not to get off track, but Josh hit it. Politics. This ain't about politics. To the lawmakers is what I say. This is about a right to health, to choose our own health care coverage. A holistic approach and so forth. Whatever. This was mentioned about the alcohol kills. and guns. I think we just had a shooting yesterday at one of the campuses, North Carolina or somewhere, maybe somewhere through there. You know, if you want to play politics with that stuff. But you know, we know the reality and the truth. Quit dumbing yourselves down as a politician and trying to tell yourself that the stigma is the truth when it's not. Go back in the history, research history. There's a lot of documentation. There's a lot of things to prove it. That we have researched this, plant. We have used this plant and so forth, and it was politics that criminalized it. So we have to think about that. It was so to, I guess, to move forward. What can we do? As a community and as an industry, I can't say it enough. We need to unite and we need to go against the lawmakers. We need to get what we want. We need to reach out and contact, and I tell people all the time, reach out and contact your legislators. And I say plural. I don't mean just contact your representative and your senator. There's 132 legislators in the state of Ohio, and they all push a green button or a red button when they vote. And when they vote for all of us. They're not voting for just their constituents. So Juanita Rep Brent, I love her dearly. I remember when she first came in to the House of Representatives, and she always told everybody, I am a representative for the people of Ohio. And she travels the state of Ohio. That lady, she knows what to do. And what we need to do is, regardless if you feel defeated or you feel down or whatever, we need to just continue positive emails and positive phone calls to all 132 legislators, senators, and representatives whenever you have a chance, until we fully feel free and clear that we do have a great cannabis program in Ohio where we don't have to worry about, stepping out and then outside or whatever, and getting charged with some type of criminal charge with penalties and so forth simply because we consume cannabis. It doesn't happen if I'm smoking cigarettes, and very little actually alcohol laws. When you think of it, cannabis has probably got more laws than both of those combined. But keep in constant touch with your legislators. Follow the website for the State House, legislature.ohio.gov, ohiosenate.gov, ohiohouse.gov. And you could go on there, follow the links, sign up. You give them an email. That don't mean they're going to come kick your door in because they know who you are or something like that. They have to know who you are. They have to know that you live in Ohio and a way to get back with you to communicate. But sign up, and it's called tracking. You track bills and you track committees that are important to you. And you can respond to those. You can testify in person in committee hearings, or you can send in a silent testimony and send it just, to that committee chair, and they disperse it out to the rest of the members. So we got to keep our voice loud and proud. We have to stay at the State House and try to get things done, the best we can. I've made a lot of friends down there over the 10 years. I've met a lot of great people. I've met a lot of bad people. But educational awareness comes from the people. When you get a legislator that has been making bread for his entire life or her entire life in a bread factory, and they become a legislator, which is a lawmaker, they have trouble spelling law. So to get them down there, whatever the topic, that's why we have to do the educational awareness. We have to, as cannabis people, got to get down and educate lawmakers on cannabis, not just what it does for you and how it helps you. That's very good to do that. But the criminal sides of it and the regulatory sides of it and so forth, we have to let them know. Let them know some of the things that have happened, the stories that have been shared. Keep sharing the stories. Keep sharing the stories. Keep reaching out to them legislators, however you got to do it. I don't care if send up a smoke signal. So someone might pay attention because there are quite a few consumers down there at the State House, just so you're aware. So that's kind of it. We have to be united. We have to, the same as any other industry, look at our lawmakers and let them know what we hoped and what we want to happen and so forth, so that, we can go ahead with our lives.
Good point. Good point. I think, like I said, the community aspect is what's actually going to band everything together and be able to push it forward. So, like, just keep your foot on the gas pedal when it comes to making sure you guys collaborate, making sure we're doing things that will keep us as a business moving forward. And that even if we don't have the whole lot of help, and we can help ourselves. You know what I'm saying? So like that's why we started this initiative. You know, conversation saves the nation, and that's what we want to do. We want to empower folks. So like that train just needs to continue. I 100% agree with you, Tim. Let me ask this: when you look ahead, I'm gonna shift gears a little bit. When you look ahead, what does a fair and functional cannabis market look for Ohio?
Uh, for me, what I hope it looks for is justice, is for fairness, inclusivity, opportunity for all, um, and good employment for those that get into it. It should be a lifetime career. We're starting to see it taught in some of our colleges. I know several here in Ohio teach it. Josh is a professor there at Hockey College for the cannabis science classes. OSU teaches a few classes on it. Several other campuses here in the U.S. I think Cincinnati is, and I can't think of all, but all have class or courses on it now. So why can't this be a lifetime, 30-year career for somebody to retire from? With good benefits and so forth when they do retire. So that's what I'm hoping for is that we stop the penalizing of the consumption of cannabis, that we stop tearing families apart. So many times I would go with children's services in the morning, and we would remove kids from the house because mom or dad got caught with a nickel or dime bag in the car, and so we got to take the kids away and evaluate the parents, make sure they're suitable parents and all that. I mean, it was heartbreaking to see, children's service have the power that they did to do that, and then the power to judge whether you're a fit parent or not. The same as I've been challenged at the state house of being an unfit parent. It didn't go over very well for that legislator after I got done, but this is what we have to do. We have to, stand up and for ourselves and look for that bright future for to where we are respected just as much as the other industry is. We're a normal part of society, a normal part of the workforce. Our kids, are involved in all the sports or all the activities, extracurricular activities. We have kids going off to college. We have we're just a normal functioning industry community like what we see out there now. That's what I hope to see. Not just here, but across the country and around the world. So hopefully someday, I don't see that soon since I've been doing this for 10 years, and I look for another 10 years to see the adult program trying to fix this hot mess, um, of issue 2 and Senate Bill 56 both, because I think they're both epic failures in the way that they been addressed and what they've done. Actually, I think they've tarnished the cannabis community more than they've helped it. But we'll have to get past that, and we'll have to move along and look for the betterment of the program.
Definitely. Well, if you could deliver one message directly to lawmakers in Ohio, what would it be?
I would say this. I've met several lawmakers at that state house and that were anti-cannabis, totally against it when we started it. And actually just talked to one about 2 weeks ago. And when they've seen an impact of something in their family, and it was hidden from them that cannabis was being used on a grandchild or even a spouse or whatever, that they weren't following the traditional protocol of pharmaceutical drugs. And they found out what cannabis, how it was keeping their grandchild alive, how it was helping their spouse, a family member, a sibling, or whatever. To me, it was very enlightening of how they did a 360. They all of a sudden became pro cannabis. So I would tell them to uh, don't judge me for my choice of, we call it recreational use, a healthcare choice. I don't judge you for being a politician. Um, So don't judge us, as we won't judge you. Respect us, and work with us on getting this right. So that if you truly care about the safety of the children, if you truly care about the people of Ohio, then there's a right way to do this. And unfortunately, right now you're doing it the wrong way. So let's reverse course. Let's get on the right side of the road, and let's be a leading example here in Ohio for the rest of the country.
That's powerful.
All right.
Yeah, that is very powerful. It's very powerful.
So, Tim, I appreciate you, man. We thank you for the leadership, the advocacy. Like I said, we love seeing you every time. I light up every time I see Tim. Let me give me a sec. Mute this real quick. Yes, but I light up every time I see Tim. Tim, I get excited. When I see Miss Wendy, I get excited. Like they like I am always excited to see them everywhere we go. So like even
Yes.
with them being just general humans, like this is what we need, bro. This is like they're a good representation of what we're doing. Like the backing needs to be there. So
Yeah, definitely. We appreciate Tim being a strong, powerful voice on the legislative side of the cannabis realm, and helping bring that, but also just being, like Will just said, a beautiful human, and being a real person, and just showing that like we're real people that use cannabis, and it's okay.
all right.
Well, I'll say this kind of in a closing here is I appreciate the recognition. I'm sure Wendy does as well. But something Wendy and I've always said is we had mentors before us. We just didn't pop up one day at the State House and start doing this. We've worked with mentors along the way, um, and we followed in their footsteps. They've taught us. We've listened to them. They've done very well. I'll give a shout out to the Honorable Senator Kenny Yuko for being aside from labeling me as the grandfather of cannabis here, Senator Kenny Yuko is the one that started all this, and a very good friend of mine. Him and his wife both are good friends of Wendy and I. And I don't think we'd be where we're at today if it weren't for people like him and his consistent pushing and helping us get done what we've got done. Um, I would hope that those after me have looked at me as a mentor and have learned something, and that they gain knowledge and the courage and the strength to go do the stuff that I've been doing. It's always a pleasure to see you guys and your smiling faces, as it is many others around the state that do similar stuff that you guys do. But we have to have this. It's not about just, well, there's a podcast company, in Columbus, so we don't need any more. No, we need many of you guys out there, and you guys are doing a great job. I really appreciate it. It's what I've always was. When am I going to get some backup on this? When am I going to get someone? And you don't have to be backup by following me at the State House. You guys are doing backup right now. You're sharing the word. You're sharing educational awareness. You're letting people know we're working with people. We're giving them an opportunity to learn what's going on, and hopefully, if we get one person out of this podcast today that gets inspired by it and they start knocking on doors at the State House, which is actually the People's House, as Miss Representative Juanita Brent would say, it's the People's House, and we've kind of phrased that down there, use it a lot. Get down there. It's your house. Get down there, and say something. Talk to them legislators. Let them know who you are. Let them know what you're for, and so forth. But as I said, it's always a pleasure seeing all of you guys, to include Anthony, and so forth. So I think he might be a little camera shy sometimes, but you guys have done a great job. You've built a really good show here, and you've been bringing on some great guests and so forth. So I can't say thank you enough for all that you guys have done, for your support, and everybody else that's been there with us. It's just not the two of us that have done. There's hundreds, thousands of people that have encouraged us, that have kept us going, that have supported us, that have showed up, showed out, promoted, etc., etc. So we have to keep doing this. And thanks to everybody.
No, thank you, Tim. We appreciate you, bro, man. We
Thank
appreciate
you.
you. Yeah, we appreciate you, man. Thank you so much. All right, Bree, give him the shout out. You know how that goes.
Yes. Okay. Well, as always, thank you to our producer and the founder, Anthony Gaines, and the whole Ohio media team for making these live conversations possible. Everyone, stay informed, stay engaged, and stay Ohio.
All right. Holla at y'all. We off. This is our first live stream. I know it's a little iffy, but hey, we made it. We made it.
We got
So,
Tim on. Yeah, Tim's on mute. But
mhm.
thank you again, and have a good night, everybody.